Hey Flexies, what I want to do today is go over what I call low-lying fruit. So whether if you've been flux, you have fibromyalgia, you have brain fog, brain fatigue, genetic problems, whatever it is, you want to get the low-lying fruit when it comes to getting some diagnostic testing and figuring out what's going on with you. So what do I mean by that? Let me pull my PDF up here. So what do I mean by that? So low-lying fruit. So we want to make sure we get the low-lying fruit. Now, one of the things is when people come to me is, before they get the low-lying fruit, they've already done the high-lying fruit, the stuff on top of the tree that didn't work, right? So maybe they did high, expensive IV glutathione therapy with Dr. 𝗟𝗏𝗂𝗏 out in California and spent $15,000. Or maybe they did stem cell therapy, or they did some kind of therapy that is way up here on the tree, right? Way up there, the high fruit, where we want to get the low-laying fruit. You need to get the low-laying fruit in before you want to get the low-lying fruit before you do anything else. So when it comes to getting someone better, when it comes to getting you better, have you ruled out the low-laying fruit? Okay, so that's what the kind of this webinar is going to be about today is that fruit and where are you getting it? So we want to make sure we're hitting all of this stuff in here, right? It makes no sense to come up here and start picking fruit from up in here when the basic 101 things have not been done. So today's video, we're going to talk about what are the two basic things you can do to make sure that this low-lying fruit is actually being gotten. So the first thing we call here is this is called a pulse oximeter. Okay, now I'm going to show you this right here. I have one right here. This is it. Okay, so what this thing does is this thing measures the oxygen level on your red blood cells. So the two things that we want to make sure that we have gotten, that we've picked, are one, do you have enough saturation, enough oxygenation in your red blood cells? And two, is your blood pressure high enough, okay, 120/80, to make sure that you can pump your blood deep into your tissues? Now, if you have blood pressure of 110, 100, 100/60, they say low blood pressure is good, low blood pressure is good. No, low blood pressure is bad. Now, why do you want blood pressure of 120/80? Because it's the blood pressure that what we call perfusion, which is perfusion means getting deep into the tissues. So we want deep tissue perfusion, so you got to have blood pressure of 120/80. If it's low, we need to figure that out. That's something that we need to figure out. See, this is low-lying fruit. We want to make sure that this basic 101 stuff is picked. Now, for example, if you don't have the correct blood pressure, guess what? Down in your feet, your heart's up here, your feet are whatever, 3, 4, 5 feet away. If you don't have good blood pressure, by the time the red blood cell gets down to your feet, excuse me, there's not going to be enough pressure there for the red blood cells to get deep into your tissues, deep into your toes, right? Because the blood pressure is not there. And then once we deliver the red blood cells to that area, we want to use this thing, and we want to make sure that there is enough oxygen on your red blood cells. This is what this thing measures, is the oxygen on your red blood cells. So this is a tool. It's $36 on Amazon. Look this up. I've tried other brands. This is the best one. So in my opinion, you should get this one. Here's the link to it right here. You want to get this one. I've tried this brand right here. I've tried this one right here. I'm not sure if this is upside down here on the series. It's always backwards. So anyway, I've tried this one. It's a Pro Series. I did not like this one. This one gave me much, much better readings. So let's kind of dive into this. Okay, so what is the oxygen perfusion? So when you do this thing on your finger, right? So let me just show you reading, I guess, right from the start. So this is actual live recording. So I'm going to turn this thing on. I'm going to put my finger in here, and then you're going to see this come up. Okay, you see that 96 right there? So that means that my red blood cells have 96% oxygenation. Now you want to do this a couple times because this can vary from finger to finger to finger. So I have my arm up, so that could affect the reading as well. See what happens there. 97. Okay, let's kind of go down here. Try my other finger. I'm just going to bring it down here and see what this says right here. So you want to play with this a little bit here. This says 96. Let me just try this finger again here. Okay, 98. So what you really need to do is, I've played around with this clinically, is you want to do this on different fingers. Now what I found better is if you just hold it just like this, like your arm just resting just like this, and you hold it up kind of like this. This is what I found to give me the best reading on this right here. It says 97 right there, and you can see how this, so you can kind of get your finger in there deeper. So you can see how this kind of lifts up a little bit. Okay, let me see what that reading says here. Okay, 96. So really, at the end of the day, you want to be consistent about this. And if you can't get readings that say 98, 99, 100, if I do this enough times, I'm going to be able to get readings on that. If you're consistently at, like, let's say 94, 95, 96, if you can't get above 96, that tells you that you don't have enough oxygen riding on your red blood cells. And if you don't have enough oxygen, guess what? Things cannot get oxygen, and everything needs oxygen. So in here, so right in here, what we're going to do here is, you see here they say this is normal. Oops. They say this is normal right in here. Okay, so right here they say 95 to 100% is normal. I like to see this at 97%. Okay, so we really want to shoot for something that's at the 97% or greater. If you're sitting at, let's say, 96 or less than that, okay, that's telling you that that is a problem, and we need to, you need to figure that out. Like, I don't know, maybe you have an iron problem. I mean, there's multiple things that we can do to figure that out. But this is a low-lying fruit that needs to be figured out. Okay, then here. So just to kind of give you a visual right here, what we're looking at. So this is a red blood cell. You see the oxygen right here. You see this is a hemoglobin. So we have a hemoglobin right in here. And then we have a little oxygen molecule come right in there. Now you can see right in here, you see all these oxygens in there. Oxygen, oxygen, oxygen. That would be a high percentage. So let's say you can shoot at like 98% saturation. Oxygen saturation. Okay, we're talking about oxygen. And then when it goes to the cells, you see how this right here is going to deliver oxygen to the cell tissue right here, right? So we want saturation. We want to use this machine here. And, in my opinion, we want to be shooting at 97 to 100%. If you can never get readings in that area, I would tell you that this is something that needs to be looked at. And this is a low-lying fruit because it's simple. This thing here that you can get on Amazon is $37, right? So let's spend some money on things that are simple that we can actually check. Okay, here's just another example. The more visuals I give, the better. You can see here, you can see the iron right there. Okay, you see the iron right there. So one of the things, maybe you have too little iron, right? So maybe you're considered, maybe you can't be diagnosed as anemic. I find this a lot. Is they quote can't be diagnosed with anemia, but you're on the low side of what normal iron is. Because if you remember, iron is what delivers, right? Is what delivers the oxygen to the cell. So if you have low iron, you're going to have poor oxygen delivery, because the iron here is what grabs onto the oxygen and delivers that to your cells. Okay, so we want to make sure that that is in place. Just here's another example. Again, I like to give examples. You can see, I'm not sure if you can see it in there, if you have to blow it up, but there's the hemoglobin, and then the oxygen attaches to the hemoglobin. We have full oxygenation. Let's just say here we have 100%, okay? Then it delivers oxygen to your cells, and then this oxygenation goes down, okay? So again, we just want to make sure that this is in place, and make sure that this is correct. Now here's the second low-lying fruit This meter right here, $37 on Amazon. You can get it in 2 days. The second low-lying fruit is blood pressure. Blood pressure of 120/80 is critical. If you have anything less than that, that's telling you that there's not enough pressure actually to pump that blood, into the tissue. So just with these two simple tests, one, we've checked your oxygenation. What percentage of your red blood cells have oxygen? Okay, so let's say that's slightly low. Let's say you're sitting at 94, 95%. And then on top of that, you have blood pressure of, let's say, 110 or 100 to 110. So you have two things, low-lying fruits, that are pretty simple to handle that you can look at to see if this is causing your problem. Because if that's the problem, you're not going to recover. So bam, here's a test, or here's the thing on Amazon, blood pressure cuff, 5,722 reviews, bestseller in the category. And these are all the things that can happen if you have low blood pressure. Dizziness, blurred vision, fatigue, depression, lack of concentration. All these things here can be because of low blood pressure. So, I hope at the end of the day, you found some value in this. Always, when it comes to your case, please, 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 always go for the low-lying fruit first. Never go for the top. I've treated thousands of flaxseeds at this point. I can't tell you how many people have come to me and they go to doctors that provided the fruit on top of the tree. Like, that's the shiny silver star, it's the brightest silver coin is on top of the tree, and people always think that's the best. And in my opinion, that is not the best. If you don't have basic 101 functional medicine principles in, you're not going to get better. Start with 101 basic principles, and these are 2 basic principles. Hopefully you found value in this. Take care. Bye-bye. Where there's help, there's hope.